It's a historic action from the U.S. Department of Health and Human Services as the FDA is starting the removal of the black box warnings from hormone replacement therapy products for menopause. This is huge in the menopause world.
Okay, so I'm not sure what exactly this means, but thankfully we have someone who does. Dr. Frank Barone is here. Thank you so much, Dr. Frank. And you brought someone who is part of your office as well.
Yes, this is April Diva. She is a nurse practitioner, and she runs our wellness program for weight loss, aesthetics, and general wellness.
So we're talking about the whole health here, and all the things we've talked about with you, it seems that's the root of everything. HRT is beneficial for women and not something to be feared. That's what we're hearing, right?
Correct. Well, this all started in the 1950s when researchers at Cleveland Clinic realized that hormonal therapy can help women with a lot of their symptoms in menopause, so it became very popular. And then in 2003, they did a $1 billion study, which back then was huge.
A lot.
And the embarrassing thing is they messed up. The interpretation of the data was wrong. They had a press release before the information was published, and they put a warning on any estrogen replacement that it could cause breast cancer, blood clots, stroke, and cardiac things. Actually, the women who were taking estrogen had less breast cancer, estrogen alone, and they were wrong in all of that. So for 23 years, women have been denied these life-saving medications and quality of life, and they're just realizing now from all the experts panel that just was released in November at a press conference for the FDA that they made a big mistake, that these are beneficial. And actually the risks of not taking hormonal replacement for these patients, and not just women but also men, is higher than the risk of taking them by far.
It's so shocking the amount of 20-some years that women could have had relief. I mean, how are you counseling patients who now come in and say, can I do this? Like, what are you saying to them?
Well, we're just getting started in this arena, and I think overcoming medical dogma like this is very difficult because they see this black box warning and they think, oh, this might give me breast cancer or cause a cardiac arrest, when in fact it doesn't. And in fact, your risks are higher by not taking it in the appropriate patient. And so consequently, changing this is going to be very difficult, but it's a huge message. The number of women that get cardiac arrest that could be saved by this, or fractured hips from osteoporosis that could be helped, urinary infections. We didn't even talk about neurological, Alzheimer's, dementia, mood depression, fatigue. The list goes on.
Hot flashes. Yes. I mean, it's the whole spectrum. When you're counseling people for their total wellness, what are the complaints that women, let's say my age, late 40s, mid 50s, what are they coming in and asking your help for?
I mean, everyone's aware of, your typical hot flashes, having trouble sleeping, the mood changes, but there is a list of 50+ symptoms. And a lot of women who start on hormones, then they have symptom improvement, and they're like, I didn't even realize that was going on until that got better. Everything from skin and hair. There's so many things that hormones, I mean, we have receptors in our whole body. So everything from our brain all the way down to our bones, we're going to be affected by the hormone replacement therapy positively.
So that's for women, and obviously there's a lot to that as well, but is hormone replacement therapy for men as well?
Oh yes, people generally think, well, testosterone's for men and estrogens for women. That's not the case. Women need testosterone. They benefit from it after menopause, and men have estrogen receptors in their bodies too. There's a reason why most of our organ systems have receptors for these hormones. All the organ systems just about, especially in the brain. So for men, it's not just about libido, it's also about muscle strength, fatigue, mood, sleep quality. And this all impacts your health. This all impacts quality of life. So at EVOLV, we're trying to get people to be the best they can be, and we say live longer, better. Well, you can't live better if your hormonal milieu is not proper. You can't reach your potential of health. You can't be your best self. You can't sleep as well. You don't have as much energy, and the list goes on. It's a big domino effect. So even, cardiovascular disease is reduced by 50% in women who take HRT compared to the same control group that do not take it. We're talking about billions of dollars on the health system here, as well as quality of life for people. And all-case mortality is lower in the women that take HRT than don't. So we're talking about life and death here, as well as quality of life. It's a humongous message.
So that's the question when we come in, how do we start the counseling process? We know everyone is different.
Yep.
So what do we do for patients when we come in to talk to you guys about total wellness? Before I worry about my wrinkles or my hair, I'm like, I gotta feel better.
Yeah.
How do you start this process?
We start that with a consultation, and every single patient is very one-on-one. We need to gather in your symptoms, we need to look at your health history, your family history, and then we're diving into some labs and kind of doing this combination. Now there's obviously a risk versus benefit conversation, and we individualize that, but then once we have all of those pieces to the puzzle, then we can dive into that customized treatment plan, looking at which route we're gonna replace that hormone with, and then also having that conversation about bioidentical. That is huge, especially with that study. Synthetic versus bioidentical is totally different two forms. You can't just lump all hormones into one.
This is what I have to investigate now. Yeah. I got to figure out what I'm on, and you guys are going to help me.
Yes, it's all related because we're trying aesthetics to make people look and feel better. And consequently, your overall health is a huge factor in all of that. You can't reach that if your health is not optimal. So this is all connected, and it's a big story. We call it Patients for Life because we look at this as a long plan for patients. But it's a very big issue, and I think it's going to be adapted by the medical community. There's no training on this in medical school to speak of, menopausal medicine. And Holly Berry made a big deal about it recently, so has Oprah, and I think you're going to see it. But the problem is there's going to be a lot of rumor and misinformation and people who try to profit on this. So patients have to be very careful where they go for information and make sure it's a trusted, reputable source that has experience.
Like Dr. Frank Barone from EVOLV Plastic Surgery and Medical Aesthetics. Thank you guys for being here. Appreciate you. Appreciate this information. All right, we'll be back with more on the 9 after this time out.